Hello, sir. How are you?
I'm good. And you?
Fine. Nice to meet you, sir.
Nice to meet you.
So I'm from Bangladesh.
Mhm.
Yeah, and Bangladeshi many IVF patients came rapidly now in Thailand because India is stopped. Uh, Before, Bangladeshi patient go to India, but now India totally stopped and they move to Thailand. So that's why we want to make some opportunities for our patient to find out us where is IVF center is which IVF center is good in Thailand. I see you location is perfect place in Thailand and middle in Bangkok. So people are reach you easily here because of central world. This everybody know about this area. So that's why I came here and I have some question also because Bangladeshi people want to know something about IVF Center. Your Genea is very renowned. Some people know about you, and they inform me if you can go there and take the information from their center. It will be helpful for patient.
Oh, my pleasure.
Yes, sir. So, sir, can I question you?
Yes, sure.
Yeah. What is IVF and how does it work? If you can explain.
IVF stands for in vitro fertilization. It means that the process of fertilization will not process normally in the human body. We will take off the process to do it in the laboratory. We bring the eggs out from the female patient, and also we get the sperm from the male patient, and then select the good sperm to inject into the eggs directly. That one we call it the ICSI.
Yes.
And for the IVF itself, it's actually start from the other technique that just only combine the sperm and the eggs together and let them fertilize by themselves. So we can choose either IVF conventionally or the ICSI, depends on the patient condition. And this is the thing that help us to see the process of fertilization, so we have chance to select the good embryo and transfer back to the womb. So that will helpful for the one who is struggling with pregnancy.
Thank you, sir. So I have another question. Who should consider getting IVF treatment?
Actually, there are so many options for the patient who would like to get pregnant. It maybe start from the simple way, like just timing the intercourse. The patient have to know when she will have ovulation, so they can have the intercourse during that time to make sure that the sperm, the eggs, have a good chance to fertilize in a natural way. By the way, because some patients have the problem, for example, have some tumor, have some adhesion or scar in the pelvis, so the sperm and egg cannot meet each other by that way. So we can move to do the other step by the IVF or ICSI. So in general, if the patient have problem for getting pregnant at least for 1 year, I think it's good timing for the patient to go to see the doctor for evaluation and choose the better choice for them.
Thank you, sir. Sorry, I have another question. How long does the IVF process take?
The IVF itself is up to different steps. The first one is to create the embryo, and the second one is to transfer the embryo back to the womb. The process to create the embryo is start from we use the injection medication on very first day of the period start. Like the period start on today, we can start the injection in the next day, and this will last for about 10 days by average. And then 2 days after the last shot, we will take the eggs out and do fertilization on that day. So you can see that the process is like about 10 days plus with the next 2 days is totally not longer than 12 to 14 days. Yes. And after that, they can go back home. In your case, they go back to Bangladesh and then get the result of the embryo process of the development by the email. And then when we quite sure already that we have the embryo that qualified to transfer, then the coming cycle of the period we can declare the endometrial lining at home, taking the medicine at home, and come to Thailand again for monitoring the lining and take the medicine for about 6 more days and then transfer the embryo. So for this period, the patient may need to stay at least around like 7 to 10 days, but not longer than that. And then they can go back and do the pregnancy test in home country.
Oh, nice process, sir. Sir, I have another question. Are there any risks or side effects with IVF?
It's have to accept that any procedure can have some side effect, but it's not so common for the IVF because the thing that we use in the hormones injection is actually the same thing that the hormones in the body of the female. So the side effect is just only because sometimes the hormone is higher than the natural cycle. She may feel some changes like the breast tenderness, bloating, but this one will be controlled under the consideration of the doctor about the dosage of injection. If you use a proper dosage, we have to balance between the eggs grow up and also the health of the patients. And we have many choices of the medication. So this is something that we can make sure that is safe enough for the patient. And for the process itself, because we do the anesthesia, so maybe it's possible to have some risk of getting the anesthesia, but also not so common. And for the procedure that we extract the eggs out, we use the needle, so it's have bleeding for sure, but mostly it's just only the like needle hole wound, so the bleeding will not so much. And the patient can recover quite well after that. And the other thing that we need to concern is about the risk of infection. But you know that the standard of medical treatment nowadays can get rid of the infection almost 100%. So most of the patients come here have no problem at all.
Thank you, sir. If you can describe about your Genea and location, please.
Genea Thailand is located on the 10th floor of the central tower here, like in the Pathumwan district, in the central business district in Thailand, in Bangkok. You can come here quite easy because it's surrounded by the many kind of transportation, and the most important one, the BTS SkyTrain. So even you're living in the hotel, you need not to stay nearby. You can stay somewhere that near to the BTS, and then you come here by the BTS quite easy. And need not to worry about the traffic because Bangkok have a big problem about the traffic. So that would be a good option.
Thank you, sir. Thank you. I'm really happy to meet you today.
You're welcome.
Thank you so much.
Thank you.